Hello friends and viewers. It's been quite some time I didn't come online due to various reasons of my engagements in my clinic. But today we thought of discussing a very important topic which is plaguing us since time immemorial and also especially during this season, the winters. What is the most commonest thing which we find, especially in aged people who are in geriatric situations, is arthritis. Arthritis, as the name itself indicates, it's the inflammation of the arthra or the joints. The most commonest we find today is rheumatoid arthritis and osteoarthritis. Rheumatoid arthritis is more of an inflammatory condition because of the immunological changes which happens in our body for various reasons, including our lifestyle, and also maybe a genetic factor also is involved in that. But osteoarthritis is more of a degenerative condition because the wear and tear which happens in our joints, especially in the knee joints, those are the most commonest one affected, and sometimes even in our hip joints as well, even though it's very less presenting. So what happens in degenerative conditions is the gap between the joint is reduced, the soft tissues or the connective tissues are inflamed because of the gap reduced, and maybe probably because of overweight, a lot of pressure on the knee joints because they are the weight bearing joints. So because of that, the fluid which is there, synovial fluid which we are there as a lubrication and also to absorb the shocks in our day-to-day activities is reduced. So automatically there is a wound which develops which leads to inflammation. That's what we call it as osteoarthritis. So how do we address these conditions? Yoga therapy has been known to understand this in a very nice way and also to address it very effectively. But we'll have some limitations as well in that. It depends on what is the stage you are coming to yoga therapy in the arthritic condition. Whether it is the early stage where you don't have too many symptoms or maybe a little bit of stiffness and pain, no swelling or anything, your mobility is still intact. So in that situation, yoga therapy does a great job to help you to prevent any further complications, and also at times maybe if you are very effective in taking care of your lifestyle as well along with yoga therapy, you may even prevent the surgery needed. But we'll also have to understand in inflammatory arthritis like rheumatoid arthritis and all, if already deformities have developed, so then we may not be able to help you to a large extent in yoga therapy, but we should be able to help you along with your other therapies. Maybe anti-inflammatory drugs, Ayurvedic medication or homeopathic medication, acupuncture, and all these things, including the lifestyle changes addressed. Yoga therapy can be a great tool to complement those medication to manage your rheumatoid arthritis as well. So what exactly happens in yoga therapy? There are three things which is important in yoga as far as I understand in my experience. One is at your physical level, the asanas. The next is at your breath level or energy, which is pranayamas. The third one is your mind, which is to deal with your meditation, relaxation techniques, all those aspects, even mantra chantings, all those things. So what exactly happens? When we do asanas, it will improve your joint mobility. We have to let me put that how we have to do in a later perspective, later stage. So when we do asanas, it will improve the mobility of our joints. So it will preserve the joint structure to large extent. So we advise those kind of asanas which you are able to do. So it needs to be done under a proper guided yoga session by a yoga doctor or a therapist who is certified and registered. Then the pranayamas. How does pranayamas help? You may feel that it is now how it is connected with my joints. So what we understand in traditional medicine is all these arthritis or wear and tear usually happens due to various reasons of lifestyle addresses or lifestyle imbalances what we practice in terms of food, in terms of exercise, in terms of our sleeping habits, and also the stress. So pranayama is like a bridge between our mind and the body. So when we do pranayamas, it will help your body also to make the energy flow better, the prana to flow better, which we call it as Qi in traditional Chinese medicine, and acupuncture deals with that. So pranayamas will help you to normalize the flow of energies in the nadis. So that's why it is very important. At the same time, it will also help you to improve the healing capacity of your system. So what exactly happens in our sleep? So in your deep state of sleep, the purpose of sleep itself is to heal and repair you. So that's exactly what we are trying to replicate in pranayamas. And when it comes to meditation and relaxation techniques, it's again helping you to manage your stresses of the day-to-day life. So, and also emotional balance. See, most of the arthritic conditions, they are already emotionally down because their quality of life has reduced to a large extent. They cannot do the day-to-day functionalities what is required or expected out of them. So so it's a big burden on our emotions. We may get angry easily, we may become sad, and a lot of anxiety and depression can come into our lives when we are having low quality of life. So in yoga, when we do meditation, when we do relaxation techniques, those stresses are minimized and we get into a state of balance in terms of our emotions. Then we can reason out why I am reacting or overreacting for these situations. So that will help you to reduce the stresses. Not just that, it will also improve our healing capacities of our body. We should always trust our bodies. The God has created a beautiful being of ourselves, a very good species which has immense capacity to improve our healing, which has the healing capacity. So relaxation techniques will help us to heal better. Pranayamas will help us to bridge between the mind and the body. Asanas will help us to improve the mobility of our system. So a comprehensive package you get when we do yoga under a right guided practitioner or yoga doctor or yoga therapist, so that when you do on a regular basis this yoga, to large extent you can manage your arthritic condition to prevent surgery or even the pain management as well. So along with this yoga, if you complement in advanced conditions of arthritis with other therapies, it will be a great package for your quality of life to be improved. That's how we can manage with our arthritis. I hope I have addressed those conditions which you may be looking out for, especially in osteo and rheumatoid arthritis. View many other videos as well on our channel which will help you to improve your health and also maybe for your friends and relatives as well. Watch our videos, subscribe to our channel and share your comments. Thank you so much.